Welcome to Marian Ayurveda. In this episode, I have with me today Prabhu, a patient from Kannur. This person came to me as a savior, suffering from severe lower back pain due to a disc protrusion. He was someone who couldn't even stand, sit, or lie down for even a short period of time. After that person came, it turned out that they also had another associated condition, migraine, which in fact was even more troubling than the back pain. Up to a certain extent, it was the migraine that bothered them the most, so they mentioned that as well. We decided to treat both issues together, and within a few days we were able to significantly reduce both problems. In this video, we are going to see how that was achieved. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. Today with him we have Privil. Privil, where in Kannur is your home?
Marakartandu.
Okay. Can you tell us what difficulties you were experiencing when you came?
Oh, mainly back pain.
You had back pain.
I had headaches.
You had migraine headaches, back pain. How was the back pain? And then joint pains. You also had joint pains, right? How were all those? How was the back pain? Were you able to sit like this?
No, I can't sit like this for long, and I can't stand for long either.
You can't stand.
And then for the past 1 or 2 months, I've been able to walk a bit faster at home. I haven't gone outside for 2 months now. I haven't gone out at all for 2 months.
You haven't gone outside for a month. Are you able to walk now?
Are you able to walk like this now?
Walk.
I don't feel that pain anymore.
You don't feel pain and you can stand as well? Has the pain in your joints reduced?
Most of it is gone, just a little bit remains in my finger.
It has reduced by about 90% and my mind feels better. Okay. Then there was one major problem you had, the trouble with migraine, right? How many years has it been since you started having migraines?
20 years since the time my daughter was born.
For more than a year, she used to have it every week. Even up to a day. How was it?
It would come. Sometimes it would come, then it became twice a month. And like that, I used to have headaches almost daily for a week.
There used to be a headache, a pain like my head was splitting.
Yes, even after sleeping and waking up, some days my head would still hurt.
Okay, now since you came here, how many days has it been? 3 weeks?
It's been 3 weeks.
Now, in between that, we started the medicine in the first week itself. After that, then?
Mind.
So after coming here and undergoing all this treatment, usually when we treat a disc problem with heat therapy, the pain tends to increase during that period. Then menstruation occurred. At that time, the headache usually gets much worse. For people with migraine, that hasn't happened, right? The headache didn't get worse either. That's one thing. We don't usually have such reliable treatments for headaches. Also, we haven't given any painkillers for the headache, nor have we taken any painkillers to prevent it. After so many days, this might be the first time in years that you've gone this many days without a painkiller, isn't it?
There is pain.
Yes, that pain. Do you usually take any other painkillers or pain relief tablets for it?
The pain lasts for about 3 days. If it starts today, it will last for 3 days. For the first 2 days, I somehow managed to bear it, but on the third day, I can't take it at all. If I have to go out anywhere, it becomes unbearable, and I have to go out in pain.
So if you have to go out like that,
I keep it stocked up.
to keep it ready.
Will it last as long as possible, or is it that you just can't bear it anymore?
Okay, so here's the thing. This is how it is for us now. Everyone has changed a lot. So unless you eat a lot of spicy food, you can't really bring it back to how it was. If you drink a lot of tea or coffee, after doing all this, there's still a good chance that the migraine will come back.
Don't drink it?
You shouldn't drink tea. Neither tea nor coffee is allowed. Just drink milk or water, brother. Did you drink milk or make it diluted with water? Otherwise, drink human water or something like that. Eat or drink something like that. How is that person's headache now?
I'm saying it's completely gone. In the morning when we wake up with a shawl tied around our forehead, that's a scene
We see that every day, right?
At that time, do we feel discomfort? It's kind of a raw feeling like something is not quite right, but you can bear it. Nothing has really changed here. After coming here, that's when I realized that happiness. When I wake up, I don't have any of those difficulties. Sometimes if I overdo it, I might feel a bit of discomfort. But after that intense pain passes, the girl gets really angry, and I don't even look in that direction. Then I feel sad. But what can we do? It's a situation where we can't do anything. Later, when this back pain started to be connected, sir, that's when I realized that it's good to change the medicine for this migraine. Even if it eventually subsides and I feel happy, if that lingering physical tension doesn't completely go away, in the morning, I still wake up with a truly agonizing and splitting headache.
The headache doesn't go away. I have even thought that I should do some kind of social awareness about this headache because there are so many people suffering from it these days.
Is it going away?
As far as we are concerned, the treatment is very simple and inexpensive. The medicine is very basic. At the same time, there is only one rule. You need to make a small modification by reducing spicy and sour foods. You can eat meat, fish, and eggs. There's no restriction on those. But you shouldn't add a lot of tamarind, chili, kokum, or garlic. Basically, avoid anything that makes it too spicy. If you do, then the headache will come back. It will cause problems. Likewise, you should eat on time and sleep on time. That's all you need to do.
Yes, I eat food.
Yes, all that is fine, but still, if we have this acidity, whatever we do won't help. Like I said, if you add too much tamarind to the sambar, or if the sourness of the gravy or the curd is too much, that's a problem, you know? All that should be completely avoided. If you want to reduce the sourness, it should be mild. Instead of using 2 or 4 tomatoes, just use 1 tomato. If you usually add 2 pieces of kudampuli, just add half. I'm not saying to avoid it completely, just reduce it. We can reduce the quantity of that, okay? Then, along with our back pain, even migraines will get better. That's an unexpected bonus from God, even though we're mainly treating back pain.
Said it.
Okay.
Honestly, we never expected that so many photos would be taken and that it would all be free, just like that.
So,
It was truly amazing.
very happy. Yeah. In one sharing, let's think about one thing. How did both the person's migraine and disc bulge improve together? For this, we didn't give 2 separate medicines for each condition. What we corrected was only the acidity in this person. That's all we corrected. It is precisely because of the severe acidity that this person developed a disc problem, as we know. When acid passes through the blood and reaches the disc, it can quickly lead to degeneration or loss of moisture. When this happens, acidity becomes the cause of the disc bulge. The same acidity is also the main reason for the migraine in the head. We know that when a person carrying a virus travels, it can cause a viral irritation leading to a sudden headache. Or along with acidity, if they are exposed to sunlight, the nerves in the head heat up and it quickly turns into a migraine. So here what we corrected was only this person's acidity. By correcting just the acidity, we can address the cause of their disc problem. We have also added treatments for the disc issue. Plus, if the acidity is not resolved, even if the disc problem improves, after some time, the disc issue will return. That's why we focus on eliminating the root cause, which is the acidity. We were able to successfully and completely resolve their severe migraine condition. As I previously mentioned, migraine is a medical condition that we can treat remarkably quickly and effectively. Recently, an individual living in the vicinity of our hospital actually developed clinical depression because of their migraine. It is incredibly painful, and for us, even the smallest issue related to it can be extremely distressing for both the patient and our medical team. The treatment is also almost cost-free. Migraine treatment is like that. At the same time, it is a treatment that can deliver results as high as 99.9%. That's what we call migraine. Let's meet again in another episode. Thank you.